Tonight, though, health officials on high alert as a second case of the mysterious and deadly coronavirus is now confirmed inside the United States. A woman from Chicago has tested positive. That happened after she came back from a month-long visit to the country of China.
And at least 63 other potential cases now are being investigated in 22 states. 2 other cases also have been confirmed in Europe and France. Coronavirus has already killed at least 26 people in China, and it's made more than 900 people sick all across the globe. The Chinese government has sealed off several cities, including Hunan, which is considered ground zero for the virus. The CDC is advising against traveling there unless you absolutely positively must.
11 Alive's Latasha Givens sat down with the Associate Chief Medical Officer at Emory Hospital to answer a lot of the questions many of you have been asking.
Health officials are focused on doing what they can to prevent the coronavirus from spreading. Flights from the heavily affected parts of China have stopped, so there hasn't been a need for screenings at Hartsfield-Jackson Airport, but they are prepared. Right now, we don't have any reported cases in Georgia, but officials tell us it can take up to 2 weeks for those symptoms to show up, and we're not out of that window just yet.
We think the incubation may be about 2 weeks, and that is something that we're thinking about a lot these days.
Colleen Kraft, the Associate Chief Medical Officer at Emory University Hospital, was on the medical team who treated the first U.S. Ebola patient back in 2014. She sat down with us to talk about the coronavirus and address the top concerns from 11 Alive viewers. First up, a question from Shirley, who wants to know how the virus is spread from person to person.
The inhalation of droplets when somebody else coughs that may be in the air. A route that we don't often think about is really like our environment can transmit it.
Kraft says while you may move away when someone sick coughs near you, but touching things sick people have touched is just as crucial. The takeaway, wash your hands and sanitize commonly used items as much as you can, especially in public places. Davina has a question about vaccines for the virus.
Because this is so new, there is not a vaccine, but I will tell you that researchers at the Hope Clinic here at Emory are going to be studying this virus and trying to create a vaccine against this virus. If we can make and create a coronavirus vaccine, we may also be able to prevent even the common cold.
Kraft says there are a few companies that have experimental drugs, but unless there's a surge in the U.S., they won't likely be used. She says for now, the only treatment for the coronavirus is respiratory supportive care. And Lisa wants to know about the Texas A&M student who is believed to have the virus. Officials have not listed that case with the 2 confirmed U.S. cases in Illinois and Washington state. But the CDC told us it can take 24 hours to get back those test results.
This afternoon, Delta issued a travel waiver for Beijing and Shanghai flights scheduled from January 24th through January 31st. The CDC previously issued a level 3 travel advisory. Although the city of Wuhan has been shut down for travel, any passengers who had that city on their routes recently will be screened at major U.S. airports.
And we have everything you need to know about coronavirus, including the symptoms and the very latest warnings from the CDC. It's on our website, 11alive.com, and on our 11 Alive news app.